Welcome to Podcast UK.
Today's topic is body dysmorphic disorder.
Right, everyone. I'm Sanjay Majumder, and today we are going to be discussing a topic that's really important in plastic surgery, especially with the mushrooming of cosmetic surgery and cosmetic procedures. We're going to be discussing body dysmorphic disorder. Now, this is something that we plastic surgeons face not infrequently, but actually we don't really know a huge amount about it. So I thought we'd get someone who knows a lot more about this than I do. Dr. Vivek Majumder is a member of the Royal College of Psychiatrists and is currently working as a registrar in psychiatry in Cardiff. Now, the identical surnames isn't a coincidence. Vivek is also my son, so I have the greatest pleasure in welcoming Dr. Vivek Majumder to Podblast UK. Welcome, Vivek.
Thank you very much.
Perhaps we can start with a definition. Please, can you define body dysmorphic disorder for us?
Sure. So the definition of body dysmorphic disorder is described in the DSM-5 and the ICD-11 as an obsessive compulsive disorder focusing on part of the body.
Now, you've referenced DSM-5 and ICD-11. Now, from memory, DSM-5 is the fifth iteration of the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association, and ICD-11 is the 11th iteration of the International Classification of Diseases as published by the WHO. Now, am I right to suppose that these are, the Bibles of psychiatry diagnoses, wherein are listed the symptoms and signs used to diagnose psychiatric conditions? Is that a reasonable assumption?
I think the Bible of psychiatric conditions is exactly what both of them are. In fact, it's exactly that. The DSM-5 and ICD-11 are what we use in the UK to define mental health disorders.
Fantastic, thank you. So, an obsessive compulsive disorder where the patient focuses on one or more parts of their body. Now, that's a nice, compact definition. I like that. So, do you think you can expand on that a bit for us? I mean, what does that actually mean in terms of what the patient may exhibit or do or say, for instance?
Sure. So, as I mentioned, body dysmorphic disorder is an obsessive compulsive disorder, and these obsessions often come in hand with a lot of anxiety. These anxieties tend to be about one or more perceived flaws in one's physical appearance, and these flaws may be very slight or not even noticeable by other people. Some people with body dysmorphic disorder are preoccupied with negative thoughts about their general appearance rather than a specific feature, and may feel that they're generally ugly or out of proportion or even deformed. So there's this belief that a lot of them have that because they're obsessing about their features, other people are taking special notice of their features in a negative way or in a way to mock them. The anxiety there may cause the individual to experience obsessive worries about their perceived flaws, and patients often spend several hours a day thinking about the area or areas of concern. This can lead to compulsive behavior, so that's the other side of the obsessive compulsive disorder, and repetitive behaviors and routines to attempt to deal with the worries about physical appearance. So some common compulsive behaviors include repetitively or obsessively checking their appearance in mirrors or avoiding mirrors completely. And when I say checking their appearance in mirrors, I'm not talking about just once or twice in the day. Often these people are going 10, 20, 30 times during the day, leaving their workspace to do these repetitive and compulsive behaviors and routines. They often go out of their way to put a lot of effort into concealing their perceived flaws. For example, using heavy makeup or wearing really heavy clothing to disguise their shape, or even changing their posture to disguise their shape. They will often seek reassurance multiple times a day about their appearance. Over-exercising is becoming more of an issue and becoming more prominent, often in a way that targets the area that the person is worried about. A lot of these people might body check using their fingers to, say, point out how large their fat apron is on their tummy, for example, or something along those lines. Picking at skin to make it smooth is another thing that we see. Using tanning products or skin lighteners is common. Brushing or styling their hair in order to obscure flaws that they see. comparing themselves with other people. And again, you can see this in normality, but this is to an obsessive degree. So they're doing this multiple times a day, shopping for beauty products and over-the-counter treatments, often to their own financial ruin. A lot of these people tend to have perfectionist tendencies, and you see this with obsessive compulsive disorder in general. You may notice that the person is taking multiple selfies a day, changing the angle of their phone to try and get the best pictures they can and really, really focusing on their selfies. Or they may take selfies and then use social media image filters and photo editing apps and go beyond what flaws that you think are there. And then, of course, in relation to surgery, a lot of people with body dysmorphic disorder will seek cosmetic surgery or other types of medical treatment to change the part of their body that causes them distress. But what they find is once they have that cosmetic surgery, they will try and get another procedure and another procedure, because realistically, they will never really be satisfied with the change in their body. So importantly for individuals with body dysmorphic disorder, these worries and behaviors can result in crippling disruption to their daily life, such as avoiding social situations, avoiding going to places where they think people will see them and will judge them, avoiding going out in public or going to places like concerts, going and meeting up with friends. And as you can imagine, this has a significant negative impact on their work life and their relationships with other people. Body dysmorphic disorder can affect any part of the body, but common areas include their skin, hair, nose, chin, teeth, lips, or genitals. And a lot of those tend to be in one gender or another, with women tending to obsess mostly over the face and men tending to focus on muscle mass, body shape, and their genitals.
Interestingly, about all of those characteristics or behaviors you've mentioned, and of course, you've already partially answered this, is that a lot of these seem fairly normal behavior patterns in many people. But yeah, I mean, if I understand you correctly, you're saying that the thing that actually distinguishes patients who are suffering from body dysmorphic disorder, or at least raise a suspicion in us that someone might be suffering from this disorder, is how their compulsive, obsessive, and repetitive thoughts and behaviors impact on their daily lives. Is that correct?
Yes, that's exactly right. So, and I think the ICD-11 really highlights this very well. The difference is a matter of degree. It's a very nuanced diagnosis to make because, as you said, a lot of people have a lot of anxieties around the way they look and problems with their image. But it's a matter of degree. So if it's impacting your daily function or your ability to go out and enjoy yourself regularly, then that's when we start to think this might be body dysmorphic disorder. So this is how we distinguish body dysmorphic disorder from normal body image concerns.
Right. So what I'm taking from what you're saying is that in the world of plastic surgery, I mean, we're not specialist psychiatrists. So I suppose the take-home message for us, plastic surgeons, at this point in the podcast would be that we should have a high level of suspicion, especially for patients who have indulged in serial cosmetic procedures, or those who have unrealistic expectations, or who request cosmetic surgery for concerns about essentially normal parts of their body. Now, is that a reasonable message at this point of the podcast, do you think?
Yes, sure. Yes, I think so.
So are there any other things we might recognize as red flags? For instance, is body dysmorphic disorder associated perhaps with other psychiatric conditions?
Yeah, absolutely. The body dysmorphic disorder often goes hand in hand with conditions such as anxiety, depression, even self-harm and suicidal thoughts. And all of these should be red flags as far as a reviewing surgeon is concerned, to say, hang on a second, we need to look at this a bit more deeply.
So how big of a problem is this globally, Vivek? I accept that your experience in psychiatry may be different to our experience in plastic surgery, but is there something in the psychiatry literature that can give us an idea of the scale of the problem of body dysmorphic disorder in the general population, please?
So that we do have data on how prevalent body dysmorphic disorder is. Our current estimates is that the world prevalence is around 2% of the population. But bear in mind, this is very regional, like the USA, that can go up as high as 4%, whereas in other areas, say Germany, they report prevalences of around 1.5%. But it's important to note that it's likely that that prevalence is underestimated due to the stigma about coming out with these thoughts. The other thing to say is that they are most prominent in teenagers and young adults, and we tend to see as a time course for the disorder. They start in mid to late teens and carry on through young adulthood up until about late 20s to 30s. The other thing to say, of course, is that one's insight about their body dysmorphic disorder tends to vary quite a bit. So some people have a lot of insight, realize, hold on, there's something wrong here, that the way I think about my body or parts of my body doesn't match up with how other people think about it. So there's something going on there. Other people have very little insight and just think, well, everyone else is wrong. I clearly have a deformed nose, for example.
Yes, thank you. Now, are there any gender differences regarding the prevalence of body dysmorphic disorder in the general population, or is it pretty much equally distributed, please?
It's actually pretty equal, all things considered. I think one might suspect that it skews towards women, but it's just how males and females present is slightly different, as mentioned before. Women tend to look more towards their face or their breasts, whereas men tend to look towards things like muscle mass or their size of their genitals. So what they focus on is different rather than the actual prevalence.
Yeah, these are very interesting figures. The reason I asked you about the scale of the problem of body dysmorphic disorder in the general population is that, very interestingly, amongst patients seeking cosmetic procedures, and there have been various studies looking into these numbers, and I accept this is a subset of patients, the prevalence can actually be up to 20% or even higher in some smaller studies. So which is significantly higher than the general population. Also, the mean age in patients seeking cosmetic procedures who have body dysmorphic disorder was 35, with 60 to 70% of patients being female. This, of course, has to be taken into context that most patients seeking cosmetic surgery or cosmetic procedure are adult females. So the skew away from the general population statistic is not unexpected. Now, is there any evidence for any links between body dysmorphic disorder and social media at all, please?
Yes, so social media in general tends to focus oneself onto the body, and you tend to see a lot of very curated people on social media. Social media, of course, tends to be aimed at younger people who look at these very curated bodies and think, why aren't I like that? Why don't I look like that? And so there is that link between increased social media use and an increasing body dysmorphic disorder that we see in teenage years.
Yes, thank you. Now, that's more or less what I thought might be the link. What about risk factors? Are there any risk factors associated with patients going on to develop body dysmorphic disorder?
Yeah, so certain risk factors seem to increase the risk of developing or triggering body dysmorphic disorder. So this includes having a blood relative with body dysmorphic disorder or obsessive compulsive disorder, OCD. And we know that most, if not all, psychiatric disorders have a genetic component in there as well. Negative life experiences, some of the listeners may know these as ACEs or adverse childhood events, such as childhood teasing or bullying, neglect or abuse. Certain personality traits, and this is really, really important, such as perfectionism, is deeply linked with obsessive compulsive disorders, and so it's also deeply linked with body dysmorphic disorders. As mentioned with social media, there's a societal, cultural, and often familial pressure or expectations of beauty that one needs to consider. And this is really culture dependent. So in the UK, we don't have as much of a culture towards fair skin, but in areas such as South Asia, that's much more prominent, and you can see more body dysmorphic disorder focusing on skin tone. Equally, in places like South Korea, where they have very, very high rates of plastic surgery, that might focus on eyelid shape. And the other thing that is a risk factor is having another mental health disorder beforehand, such as anxiety or depression, can then roll over into body dysmorphic disorder.
Okay, that's excellent. Thank you very much. That's really opening up our eyes to what body dysmorphic disorder is all about. What about complications for people with body dysmorphic disorder? What other conditions can develop in patients as a result of the condition?
So, complications that may be caused by or associated with body dysmorphic disorder include low self-esteem. As you can imagine, people who see that they've got a flaw on their body somehow, that will have a negative impact on their self-esteem. As mentioned before, social isolation is a common complication that occurs with body dysmorphic disorder. Major depression and other mood disorders are also very common. As we progress through, suicidal thoughts or behaviors may become more apparent if they find there's no way for them to cope with the way that they think they look. Equally, anxiety disorders and social anxiety disorders may become more apparent, and you can see that with the social isolation, and that may develop into a social phobia in and of itself. These kind of obsessive and compulsive thoughts and routines may then generalize into other obsessive and compulsive routines. And as you can imagine, if your body dysmorphic disorder is to do with overall weight or shape, you could develop an eating disorder secondary to that, like anorexia nervosa or bulimia nervosa. And as we're seeing more and more commonly, excessive and dangerous gym use and overexercise for very similar reasons. Substance misuse is also quite common, and one must think about, as I mentioned before, a lot of men struggle with the size of their muscles, so they may go into using anabolic steroids to try and solve that. You may get health problems from their routines, such as skin picking, and you can also get physical pain or the risk of disfigurement due to repeated surgical intervention. I should point out here, both by actual surgeons, but also a lot of people with body dysmorphic disorder might take things into their own hands and try and correct things themselves.
Yeah, this is quite interesting because I was thinking whilst you were speaking, because, we had started discussing body dysmorphic disorder and its relationship to cosmetic surgery, because this is where most plastic surgeons imagine they would encounter these patients. But not infrequently in the NHS, one encounters patients who have injected anabolic steroid into themselves, usually men who have done that to increase their muscle mass and present with complications such as abscesses and infections secondary to this steroid use. And sometimes some of these patients may actually exhibit quite an irrational and uncontrolled rage as a result of the steroid use as well. Of course, these are patients who can sometimes fit the body dysmorphic disorder criteria. So I guess the next step after suspecting body dysmorphic disorder in a patient would be to refer the patient on, either directly to our psychiatrist or perhaps the GP. And I suppose a big hurdle would be to have the patient actually accept this suspicion or provisional diagnosis and agree to seek help rather than just go on to another cosmetic procedure provider.
Yes, so it depends on the health board that you're working in. Some health boards allow specialist to specialist referrals. If not, go refer back to the GP and ask them to refer on to the psychiatrist. As you mentioned, however, this is completely up to the patient as to whether they actually go or not. And likely that's to do with their level of insight at the time. This is not a case of we can force them to go and see a psychiatrist.
Yes, that's reasonable. I think the next question is regarding something that we as plastic surgeons will not be directly involved in, but for the sake of completeness, are you able to give us an idea of what are the treatment options available for body dysmorphic disorder, please?
Sure. So NICE guidelines highlight this pretty well, actually. The first line treatment before we even look at medications is therapy. And these are talking therapies that we're looking at. The most common thing that we try, probably the most effective, is cognitive behavioral therapy, or CBT. But the other thing that we can try is exposure and response prevention therapy. So this is, in essence, training the patient to learn how to relax themselves first, and then trialing them on an escalating scale of stimulus to do with their perceived flaw, and getting them accustomed and used to being calm and analyzing the situation calmly up until the point where they're able to look at themselves in the mirror, for example, and say, you know what, I'm okay with this. I'm okay with how this looks. If this fails, we then tend to go on to antidepressants. Our first shot would be an antidepressant like an SSRI. So that's your sertraline, that's your fluoxetine, that's your citalopram. And for any GPs who are listening to this, this is your bread and butter. Psychiatrists then may suggest an SNRI like duloxetine or venlafaxine if SSRIs don't work. In rare occasions, we would try tricyclics, obviously taking into account any suicidal behaviors beforehand. At this stage, we should really be under a psychiatrist before we start looking at third-line treatment, which would be quetiapine or even other antipsychotics. If we're all out of options at this stage, a general psychiatrist would then refer on to specialist services going forward, and they have their own box of tricks that they can go from there. So I think what might be of interest to surgeons in particular is what is called psychosurgery to help with these compulsive and obsessive beliefs. There are neurosurgical approaches that can help, or even something called deep brain stimulation. But again, this is incredibly rare. Only a handful of people in the UK have gone that far. So it does seem to work.
Excellent. That's actually quite fascinating, especially the neurosurgical management options of this psychiatric disorder. So thank you so very much. That's been really comprehensive, very informative. And I'm very grateful for you spending your time to do this podcast to educate us in the world of plastic surgery about this very important and I suspect increasing issue of body dysmorphic disorder. Thank you very much, Vivek.
Thank you.
Podplast UK is a collaboration between UK and Irish plastic surgery trainees and consultants. The content reflects individuals' practice and opinions may vary. If you have any feedback, do get in touch. We hope that this has been interesting and useful. If it has, remember to follow us for future sessions.